The skin, when we retract the skin, we will be finding the superficial layer which will be containing the platysma. After that, you will be finding the deep fascia layer, investing layer basically, that will be removed, and after that you will be finding the muscular layers. Now basically the sternocleidomastoid, which will be dividing the neck region into the front anterior triangle and the posterior triangle. Now focusing on the posterior triangle. The posterior triangle will be divided into occipital and subclavian with the help of the inferior belly of omohyoid, which has the origin from the hyoid bone and the insertion to the scapula. This is your subclavian or supraclavicular region. Now the contents of the supraclavicular region. You will be finding the brachial plexus trunks. The trunks, that is your upper trunk, middle trunk, upper trunk, middle trunk, and the lower trunk. Soon after the lower trunk, you will be finding the subclavian artery. Then comes your scalenus anterior muscle. Just above the scalenus anterior muscle, you will be finding your phrenic nerve. And in front of scalenus anterior, beneath, you will be finding the subclavian vein. That will be a bit deep below the clavicle. Then the other contents of this is basically the scalenus anterior muscle. This scalenus anterior muscle will be dividing the subclavian artery into 3 parts. Similarly, how the pectoralis minor divides the axillary artery into 3 parts. That's done with the subclavian or the supraclavicular triangle. Now the uppermost, the superior triangle, that is your occipital triangle. Basically the contents will be the muscles. This will be your semispinalis capitis. This will be your splenius capitis, levator scapula, supplied by the dorsal scapula now. Then you will be having the scalenus medius and scalenus posterior. Scalenus medius and scalenus posterior below the scalenus medius. Then the other contents of this occipital will be the cervical plexus. From the C1, C2, C3, C4 ventral rami. The branches will be the lesser occipital, greater auricular, transverse cervical. So this external jugular vein will be the it will be a content of the superficial fascia just above the sternocleidomastoid. Now on the occipital triangle, you will be finding the cervical plexus. That will be your lesser occipital, greater auricular, and the transverse cervical, and your supraclavicular nerves, which will be having 3 parts: medial, intermediate, and the lateral. Then you will be having your spinal accessory nerve, which will be supplying the sternocleidomastoid, and that will continue and supply this muscle, the border of the posterior triangle, that is your trapezius. So the basically the borders of posterior triangle is your trapezius, sternocleidomastoid, and the upper 1/3 of refer the theory book, clavicle.
Medial third of the clavicle.
Medial third of the clavicle.